Professor Testelin, and now I'd like to go through our second macro or macronutrient, which is fat. Dietary fat, which comes from the diet. When we talk about fat in the body, they are called lipids. This is actually a very passionate and interesting topic for me because I worked at the Clinical Research Center in lipid metabolism. First, I'd like to review the functions of triglycerides in the body. So triglycerides are one glycerol plus 3 fatty acids, and triglycerides form a source of energy in the body. As far as dietary fat or triglycerides, fatty acids will increase palatability of foods that are moderately or high in fat, such as cake and cookies. That adds to the you feel more satisfied when there's some fat in the diet. We use fat in food processing, so that helps to hold the specific food together, and it is a nutrient source. So triglycerides in foods and then in the body will be a transporter of those fat-soluble vitamins, which are vitamins A, E, D, and K. And while they transport fat-soluble vitamins, more importantly is though the triglycerides contain and transport the essential fatty acids, so those that need to be obtained by the diet and are not processed or made in the body. So what's important to note is dietary fat is 9 kilocalories per gram, 9 calories per gram. So it can produce more than twice the energy in calories than that of carbohydrates and protein. So carbs and protein only provide 4 kilocalories per gram. So in essence, dietary fat then would provide the most energy per ounce. We will get to psychological and psychiatric disorders, and we'll talk about eating disorders. And if you're interested in working with patients with anorexia, with bulimia, fat and foods are a fear food for them. And so, pats of butter, small slices of avocado, they have to relearn to eat. So as I mentioned, the EFAs, or essential fatty acids, cannot be made in the body. And essential fatty acids are important because they function to make the prostaglandins that regulate blood pressure, your INR levels, platelets, gastric acid secretions, and muscle secretions. So as you can see, dietary fat and fatty acids, which become lipids and triglycerides in the body, play an important role, and there's so many functions. So this is a picture which depicts a small infant in the hospital that has an EFA deficiency, or essential fatty acid deficiency. So it's important as nurses to know what are the symptoms or signs of an essential fatty acid deficiency. Well, it results, as you can see in the baby's extremities, the lower extremities, there's eczema and skin lesions. Also, when we talk about alternate feeding routes with patients that are fed intravenously, TPN, a patient that is on TPN that only provides carbs and protein and not that lipid source will eventually have an EFA, or essential fatty acid deficiency. So let's look at this graph, and the x-axis is the milligrams per deciliter of blood glucose levels. The y-axis is your postprandial, so your minutes after a patient starts eating. So what this graph depicts is, if you look at the red graph, the line, it shows a high carb, low fat meal. So a high carb meal with low fat constituents will send the blood glucose level up after 1 hour postprandial. So it looks like after 1 hour of eating that meal, the blood glucose levels go up to 180. Now looking at the green line, which is opposite a low carb and high fat meal, it represents that fat slows down digestion. So what that means is there's actually a benefit to have some fat in your diet, and that helps to stabilize the blood glucose levels. So when we get to chapter 15 and we talk about type 1 and type 2 diabetes, we like to see the postprandial level, the 2-hour postprandial level, at 140. Triglycerides are, in essence, stored as adipose tissue in the body in the form of fat. So this stored energy is super important to supply calories during illness. So when your patient is in hypermetabolic stress, like COVID patients, in the starvation mode, such as with eating disorders, or maybe athletes after prolonged physical exercise. So not only is triglycerides a source of stored energy, they are a protector of organs, and they regulate temperature and provide insulation to the organs in our body. I want to talk about phospholipids now. And phospholipids in the body form part of the cell membrane structure. So they function as emulsifiers in the cell, and that emulsifiers help to keep fats dispersed in the bodily fluids. An example of the main phospholipid is lecithin. So since lecithin primarily functions as a transporter of lipids in the body, think of lecithin having a benefit of carrying fat and cholesterol away from your heart. So researchers once thought that lecithin could provide that same benefit by supplementing with oral supplements of lecithin. But unfortunately, that didn't pan out, because in their hypothesis, lecithin is utilized by other parts of the body and not just the heart. Okay. So looking on next to sterols, sterols have a regulatory property function. So sterols make bile, they make vitamin D, sex hormones, brain and CNS, or central nervous system cells. The one sterol that we're all familiar with is cholesterol. So cholesterol is a sterol in the body, and the most beneficial function of cholesterol is the body's formation to make sex hormones, bile, and vitamin D. So let's look at triglyceride structure. Triglycerides, being the largest class of lipids in the body and in foods, are comprised of 1 glycerol, and 3 fatty acids. Fatty acids are then broken down into saturated fatty acids, monounsaturated, and polyunsaturated fatty acids. And I want to go through each of these 3 fatty acids and explain their structure and then relate them to food sources, because I have seen this material on ATI and it will show up on your first exam. So starting out with saturated fatty acids, saturated fatty acids have a single bond carbon chain. So when it's single bonded, that means it's more saturated. And around that single bond is fully saturated with hydrogen atoms. Food sources of saturated fatty acids are all animal products. So all red meat, poultry, which is chicken and turkey, fish, egg yolks, and then dairy products such as milk, butter, and cheese. Now, not only are the animal products, but we do have plant products of saturated fatty acids, and I want you to think of being on a tropical island. So the tropical oils, such as palm kernel, and coconut oils, are your saturated fatty acids. So I want to explain the process of hydrogenation that fats go through. So hydrogenation is a process where that double bond is broken by adding more hydrogen atoms, okay? So the double bond is less saturated, but when you break the double bond and you add more hydrogen, that causes the fat to be more saturated and more processed. So to give you an example, this is what manufacturers do to margarine. And you'll see if when you next time you go to the grocery store or look online, if you look at margarine and look at the ingredients in the back, it'll say partially hydrogenated soybean oil or partially hydrogenated vegetable oil. The issue, though, when hydrogenation comes into play, it makes the dietary fat more saturated, more solid, prevents oxidation. So by that, the benefit is that margarine becomes more stable. And so now it has a higher shelf life. So it can be put out on the shelf and it could stay there, and the manufacturers are able to sell it at a later date. But the problem when we talk about cardiovascular disease is this is a saturated fat. It's more solidified, and saturated fat, according to the American Heart Association, still shows that saturated fats have been demonstrated to increase the rate of atherosclerosis and CVD. So it's important to know the dietary sources of all the specific fats. Moving on to monounsaturated fats, those are, think of the Mediterranean diet, okay? Mediterranean meaning where my family is from, Italy, Greece, Northern Europe. We use olive oil, we use canola oil. Other ethnicities may use peanut oil. Avocado is real big now on the keto diet, and also peanuts are a source of monounsaturated fat. So polyunsaturated fats, also known as PUFA, those are going to be all your vegetable oils. So we're going to have to memorize what are vegetable oils. Those are your corn oil, safflower oil, soybean oil, sunflower oil, sesame seed oil. Not only are oils, but fish and margarine are also polyunsaturated. So polyunsaturated further breaks down into omega-3 and omega-6 fatty acids. So your omega-3 fatty acids have been demonstrated to decrease the incidence of heart disease by reducing blood clots. So that's the main function of omega-3 fatty acids. Recently, omega-3s have been shown to reduce the risk of cardiac arrhythmias. So that's why you see on social media and all over websites that, consume your omega-3 fatty acids, and those are good sources would be your fatty fish, such as salmon, mackerel, herring, tuna, trout, sardines, but not only fish, but plant oils. So canola oil, walnuts are a good source, soybeans, flaxseed, and then wheat and oat germ are also good plant sources of omega-3 fatty acids. Now, just a note on fish oil supplements. The research, and we were involved in that, is that you have to consume 4 to 5 grams per day of those supplements, which is quite a bit. And we're still determining if it's safe and if it's effective, so the efficacy. The other thing is with the fatty acid, the fish oil supplements, is some people experience GERD, and so they'll burp up and they'll taste like the fish oil, which is not very pleasant. Now what I'd like to do is continue our digestive and absorption process as we did last week with chapter 3. So looking at the mouth, and this goes really quickly, I want to introduce another enzyme to you. It's called lingual lipase. So it's easy to remember because lipase sounds like lipid. And that's the fat splitting enzyme breaking down dietary fat in the mouth. So in the stomach, as we continue with that peristalsis, gastric lipase will hydrolyze fatty acids from triglycerides. When we get to the small intestine, remember that hormone CCK, which is cholecystokinin. It causes the gallbladder to release bile into the small intestine to emulsify fats. And then in the pancreas, that pancreas comes into play, and in the pancreas, lipase will break down triglycerides. So remember those finger-like projections, the villi and the microvilli from the small intestine. Well, the bile salts will assist the lipids to move towards them. And that's important because then the fatty acids and glycerol, they're broken down, but now they reform triglycerides once they get through that cell wall. Okay? So triglycerides will then form chylomicrons that enter what system? The fats will enter through the lymphatic system to the circulatory system, but only after they are absorbed. Okay, so what happens next is that some glycerol and fatty acids are absorbed directly into the capillaries, leading to that portal vein, which is part of the liver. Now, we do have a fatty acid enzyme, which is called lipoprotein lipase, and that breaks down those triglycerides, so the triglycerides reform again, and this lipoprotein lipase will break down the triglycerides in the chylomicrons again into free fatty acids and glycerol. It's really confusing because first they break down into free fatty acids and glycerol, get absorbed through the small intestine into the circulatory system, and then reform, okay? But this is all happening in the blood now, okay? So think about what parts of the body utilize fatty acids. And the top two choices are muscle and adipose tissue. When we look at the AMDR, which is the acceptable macronutrient distribution ranges, we recommend that we have a range of calories from fat between 20 and 35%. We want increased amounts of polyunsaturated fatty acids and limit our saturated fatty acids to 10% or less. And that was talked about last week in Chapter 4 in the Nutrition ATI work. So as we explore that cardiovascular disease, which we won't get to until Chapter 17, in 2019, the top two diets were the DASH diet and the Mediterranean diet. The DASH diet was really important, and it showed effectiveness in the treatment of hypertension, hyperlipidemia, and coronary heart disease. Now, looking at My Plate, which is put out by the government, think of it, I'm not a huge fan of My Plate because it's just a general guide. And I don't necessarily always agree with it, but it's a general guide for a healthy population. But as nurses, you might not be working with a healthier population. So just know that it is shaped as a plate, and it does emphasize plant-based products. So consuming less animal products, consuming more fish. Half of your plate should be vegetables and fruits, and then a quarter of your plate should be whole grains, and then the other quarter should be your animal and dairy products. Going back to the process of hydrogenation. As I mentioned, hydrogenation, one of the benefits is it stabilizes the fat. So manufacturers have products that have a longer shelf life. The problem is now you have a more saturated fat, and you also change the structure of the fatty acids from cis to tran. So if you look at the picture on the screen, the above model is the cis fatty acids, where the hydrogens are on the same side of the double bond. When you undergo a process of hydrogenation, the fatty acids become cis, and the hydrogen atoms will end up on the opposite side of the double bond. So the issue, though, is there is a growing body of evidence that shows that trans fat increases the risk of CVD. Why? Well, trans fats raise total cholesterol levels, especially the LDL, which is the low-density lipoprotein, which I call the bad cholesterol. Trans fats, when consumed, also decrease the good cholesterol, which is the HDL, high-density lipoprotein cholesterol. So it decreases the job of the HDL, which removes cholesterol away from the heart. So higher levels of HDL will decrease the risk of coronary artery disease. Okay, so there's an inverse relationship there. We did get smart about 14 years ago, and in 2006, the FDA passed a law that said the food label laws made the listing of the food label. So you had to put the trans fat content, and that was mandatory. But the problem is manufacturers get real sneaky and they disguise it. They won't say trans, it'll say partially hydrogenated fat or oil. So you have to make sure you look out for that, and you can educate your family and your patients on that. Also important is to know the difference between dietary and blood cholesterol levels. So blood cholesterol is a fatty, waxy substance. It's found in all tissues of cells. Dietary cholesterol is contained in animal products, so meat, poultry, eggs, fish, and dairy products. We'll talk about risk factors that are modifiable for heart disease and non-modifiable risk factors. So an elevated total cholesterol level can be modified, and that's a modifiable risk factor for coronary vascular disease. And we'll talk about in lecture, total cholesterol can be further broken down into lipoprotein levels, which are comprised of lipids and a protein. So the outer shell has this protein, and it also contains fat-soluble vitamins. So looking at the breakdown of lipoproteins, and as you know, I spent numerous hours researching cholesterol, dietary fat, and the effects on cholesterol-lowering drugs known as the statins and sequestrins, and those help patients decrease their risk of coronary heart disease by decreasing the levels of LDL cholesterol. So we'll talk a little bit more about this in lecture, but we have different levels of lipoprotein. So there's the LDL levels, the HDL levels, the VLDL levels, and the chylomicrons. But what's important to note is if you have a high LDL level, that increases the risk of coronary heart disease. If you have a high HDL level, that decreases the risk. And there's always a math calculation in cholesterol. So when you look at a patient's lipid profile, you'll note that the total blood cholesterol is equal to the numerical value of the LDL plus the numerical value of the HDL. This is an important slide that I would definitely snapshot. Take a picture of it, snapshot it. This goes over the classification of serum lipid levels. Okay. So if we look at the optimal range in the blood for triglyceride levels, we want to see it under 150 milligrams per deciliter. Borderline high would be 150 to 199. High would be greater than or equal to 200 to 499 milligrams per deciliter. And very high triglycerides would be greater than 500. We look at LDL levels, and this is what the American Heart Association looks at for cardiac risk. Optimally, we would like the LDL to be less than 100 milligrams per deciliter. Normal is between 100 and 129. Borderline high is 130 to 159. High is 160 to 189. And very high LDL levels are greater than 190 milligrams per deciliter. So for a cardiac patient, we'd like to have their total cholesterol levels less than 200 milligrams per deciliter, HDL between 40 and 60 milligrams per deciliter, and LDL between 100 and 129 milligrams per deciliter. And this is based on the NSAP, which is the National Cholesterol Education Program, and that's what the American Heart Association looks at for diagnosing hypercholesterolemia, high triglycerides, and risk for cardiac disease. So in the past, when we looked at health guidelines in terms of recommending dietary cholesterol intake, it should be 300 milligrams or less per day. But the current guidelines show that dietary cholesterol actually has an insignificant influence on blood cholesterol levels. Okay, so the limit is between 200 and 300 milligrams per day of dietary cholesterol. But what's important to note is the major dietary cholesterol in increasing blood cholesterol levels is total fat and saturated fat. So that's why it's important to know the difference between blood cholesterol, dietary cholesterol, and then fat in foods. It gets a little confusing. Over the years, manufacturers have come up with fat replacers, which help to decrease the amount of total fat in the diet. So I want to spend a little bit of time on natural fat replacers and then synthetic replacers. So the natural fat replacers are Simpless and carrageenan. So Simpless are used in dairy products, especially like ice cream and salad dressings, and that helps to decrease the amount of total fat in that product. Carrageenan, which you may have seen, it's kind of weird because it's actually made from seaweed to thicken meat. And when you turn over some dairy products, such as Half and Half, like Coffee Mate, what's the other one? International Delight. To decrease the fat, they'll add carrageenan. So look, if you use that, look at the ingredients on the back. Carrageenan has been linked to carcinogenic effects. So there could be some correlation between cancer and consumption of carrageenan. When we look at synthetic fat replacers, Salatrim still provides 5 calories per gram. It's composed of short and long chain fatty acids. I don't really see it on the market too much, but Olestra provides 0 calories per gram, and that's the product I actually worked on in a phase 2 clinical trial. And we looked at adding Olestra to specific food products, muffins and chips, and we actually did the study at the UIC Medical Center. So we fed certain amounts of Olestra between 0 and 90 grams to the UIC medical students. And let's just say that there was a lot of anal leakage, which means that at the higher levels, fat replacers cause diarrhea. So just to close, what are the practical applications for nursing students? To note that for patients to prevent heart disease and to actually treat from a diet standpoint, you're wanting to recommend to reduce total fat and saturated fat, to decrease the amount of cholesterol in the blood. And recent studies have shown that by decreasing total cholesterol and saturated fat, we can decrease certain cancers such as breast and colon cancer. Decreasing fat in the diet can also help manage type 2 diabetes and high blood pressure. And just to note, we'll talk about this a little bit later when we get to protein metabolism. Make sure you know what the high-fat meats are versus low-fat meats. So, for example, I told you I'm Italian, and we consume high-fat meats such as salami and prosciutto. There's also like bologna. Lower fat meats are going to be your poultry, like chicken, turkey, fish. So we'll talk about that a little bit later in lecture, but it is important to know for the exam and ETI material. Okay, well, thanks for listening, and I hope you have a great evening. Thanks. Bye-bye.